Today we're here with Shelby Barnes, Clinical Nurse Consultant, Population Health Management of Healthcare of Iowa. So let's start at the beginning. How did you get involved in a career in long-term care?
So I've worked in long-term care since I was in high school. I started as a CNA, then I was an LPN and RN, and then got my degree as a nurse practitioner. And so I've just kind of always been in long-term care. So.
People's stories of how they get involved are always so great. I find there are a lot of family connections, or like you, where you really start and have kind of moved along in your career. So now I know Healthcare of Iowa is on sort of a journey to apply population health management models. So tell us how that's going and what you've been learning, and how has your transition been going?
Yeah, so we're in Iowa, so we have the Iowa Healthcare Quality Partners Network, which is kind of how it all got started. It was what got the ball rolling. It helped us start leveraging in areas, with managed care that we hadn't had an opportunity to do that before, which then just kind of snowballs. And listening to everybody throughout the course of the conference, I mean, there's so many options and you just don't know what to do. So really it's been tons and tons of education and conversations, and how does this work? How does this work for somebody else, and how do we make this work for us, and is it even possible? So, I mean, it's a daily thing, just kind of figuring out what's next and what's coming and what can we do.
Mm-hmm. I hear that a lot of organizations are in that same spot, just kind of learning, and then among all of the options and plans and things, how they find one that really suits them best. So what have been the biggest challenges? And on the other hand, what have been the best opportunities?
Biggest challenges are just the unknown. I think that everybody's kind of there. Through the pandemic, everybody's still kind of in an unknown. We don't know what normal is going to look like. We know it won't be what it was before, but we don't know what that looks like moving forward. And just the unknowns in what population health management options are going to come to our sector. It's very new to long-term care for the most part. So what are those options, and what can we do with that? Opportunities to be involved, to really drive the care that we want to give. As from a clinical side, that's kind of where I get on my soapbox and say this is the care we've always wanted to give. We just have never had the resources to fund that. And now there are opportunities where we can do that, and it's amazing. So.
Right. Change is coming, but that change can be exciting.
Yes, it can be. You just have to embrace it.
So where do you go from here? What are some next steps that you anticipate?
So we are Healthcare of Iowa, along with American Health Partners and Akira and Care Initiatives, January 1 are starting our provider-owned ISNP network in Iowa. So that's our next big step. After that, who knows?
The sky's the limit.
Yes.
Well, I wish you best of luck for January 1.
Thank you very much.
Thanks for spending some time with us.
Thank you.